thank you for joining an inclusive response to COVID-19 in sport and physical activity, looking at a Sussex movement. I hope you enjoyed the live national event this morning. That will also be available online, so if you wish to go back to it or share it with partners, then that will be available. I'm just going to talk a little bit about the purpose of this session, and then we will move into the small discussion groups to reflect, and then we'll bring all the groups back in and have a bit of feedback from the facilitators, and then kind of wrap up. So, as you would have heard from the national event, before the pandemic, there was good progress in closing the unjust gap between disabled and non-disabled people's activity levels. And we were witnessing higher levels of activity through the Active Lives Adult Survey. However, as you know, it was clearly stated in the earlier webinar, the impact of COVID-19 has been a huge challenge for disabled people and the sporting world and the world as a whole. So obviously the national virtual event was to examine this impact, to listen to the national organisations and how they're responding and what they believe we can do collectively, and also to hear from disabled people and the impact it's had on their lives and some of the things again that they feel, you know, we could consider. So the purpose of this local session is a call to action really for partners and specifically Disability Sport Network members to reflect on the discussions that we've just heard, what it means to you and how it relates locally in Sussex, and then how we can think about implementing an inclusive response locally. You know, there's a lot that's already happening, and I'm fully aware that there's been a lot of innovation and organisations have responded so fantastically to COVID. But I think it's a real opportunity to reflect on what was taking place before COVID, how we have been responding in the pandemic, and how we can learn from this and obviously take on board that national overview into a local perspective, so that when we move forward we are really considering how we provide an inclusive response to all for people to get active in Sussex. We won't have all the answers today, and there will be many partners, like I said, who could not contribute or were unable to attend this session today. But hopefully this is a starting point to address the real impact, and like I said, how we can work collaboratively and shine a light on local innovation. Right, so in a minute, Ed will obviously select for us to go into a group, so please just click on that join button. Like I said, we'll have a facilitator and then we'll come back into the groups afterwards, and the facilitators will feed back kind of some of those key points. So enjoy your group discussions. Thank you. So thank you for your time in the breakout groups. What I'm going to do now is go around the facilitators and giving them a couple of minutes each to reflect on some of the discussions from your groups. I'm going to try and madly scribble a few notes as well, so I can kind of have an overview and look at some next steps. And I'm conscious that, you know, if you all attended the morning session and this is another hour, you're probably desperate for your lunch. So I'm going to try and keep to time. If we start with Nick first, is that okay, Nick?
Yeah, no problem. Thanks, Jem. So yeah, we had some really good discussions, sort of ran out of time and didn't get quite through everything. Could have done with a bit longer, but some really, really positive discussions. I think a couple of the key things to pick out from the group, we talked about on the webinar, they talked about restarting activity, but it's not just about that, it's about restarting better, you know, making sure that we build back better with our offer, looking at understanding and listening to the diverse needs of those groups that we're working with, and look at opportunities to deliver differently and innovate, and perhaps look at other partnerships. We had a really good discussion around improving confidence, which was talked a lot about, reassuring participants about returning to those activities and how we could do that. And Paul Taylor from Horsham District Council gave us some examples of what they've done, including temperature checks, and really explaining, not just saying we're COVID secure, but actually explaining some of the details of that, making it COVID secure, the hygiene protocols, even, you know, to the venue that they might be doing a session outside, but making sure they know, you know, which way to come in, one-way systems and all of those things. And also how we communicate that, you know, making sure that that's clear and concise in the information going out to participants, but also the families and the people involved. And a little sort of discussion around inclusive communications as well. You know, how are we catering for those that might be visually impaired, for example. And then where else did we go? Yeah, and then a couple of the other bits we sort of talked about, the, you know, the real difference in needs, and Ricky used some good examples of how even with the same disability, there can be a real diverse nature of their needs. So again, understanding those will help, listening and understanding those will help then you adapt that activity and that provision to cater for their needs. And you know, just before we got off, we were talking about, you know, perhaps a need to share some more of those local individual stories from participants and the benefits they get from taking part. You know, they mentioned it on the webinar this morning, and Ricky made the good point of, you know, it's talk a lot about the Paralympics, but actually, you know, on a participation level, you know, what are the benefits? We're not, many participants won't go to that elite pathway, you know, so it's important for us to share the stories of those people that get those benefits as well. And then we got cut off. So
thanks, Nick. That's really interesting to hear. So Nicola.
My group next. So yeah, we started off by actually saying that it was quite refreshing and good to hear that Sport England are taking disability sport and activity so seriously. So whether that being a change from when Tim Hollingsworth came into post, or, you know, it's been something that's been building for a little while, it's really good for us to hear, and that hopefully we'll really reap the benefits of that. It is also the points around the fact that social interaction has been so limited for disabled people. So sessions that maybe haven't been able to come back face to face yet. So it's that real lack of group environment that people are still missing, and something to really focus on for when we can go back to face-to-face sessions. But also remembering, as I think Nick just said, that we've got that opportunity to reset and start from scratch and make sure that we are including inclusion from the beginning as part of a standard offer, and not trying to bolt it on at the end. So yeah, something to kind of focus on, and in a reset kind of way. We're then talking about making sure that we look at people as individuals, and I think it's something that Sam said in the national conversation as well, that the individual is the expert in their impairment. So understanding what people need, and that everyone has got entirely different needs. So kind of making that fit for Sussex as well. So while, you know, we've got the national picture, but there are always going to be nuances in every locality. So yeah, just making sure that we're aware of what the individual or the group or whoever it might be need. We did have quite a strong theme around venues and facilities for us as well. They're kind of the biggest barrier that our group found, with often schools not letting external people in to deliver anymore, and kind of leisure operators maybe prioritising other groups because they're bringing more money. So yeah, something really to focus on for kind of when we can restart and when leisure can open up again, is to think about how we can do that in a more inclusive way. We also talked about fear, and that this is an extra burden. COVID is kind of creating that extra fear factor that may have already been there anyway, because people may have been worried to take part in activity, and there's something that's being added on top of that. And then very finally, we talked about how great this network is, and how brilliant the Active Sussex team is at sharing the knowledge and everything that we've got going on. So actually, yeah, a very positive note to end on, that this group is great for collaboration, so we need to do more of it.
Oh, that's really lovely to hear. Thank you, guys. So that's great. Thanks, Nicola. Some really kind of yeah, like you said, some positive feedback, especially around the refresh, to hear about the inclusivity being kind of the heart of the new strategies from Sport England, and really listening to people. I think there has been a massive shift in that focus. And our specific strategy and the way that we're working is about people and place, and really understanding what the needs of our communities are. So I think we're all for the strategy approach. Was fantastic. So on to group 3 and Ross.
Hi, Jem. Yeah. A lot of what you've spoken about already was mentioned. We spoke about, in terms of sort of bringing people back into activity from COVID, that there's been that sort of constant wrangle between the messaging in terms of protecting vulnerable adults and disabled people, but also for those disabled people to be told we need to get out and we need to get active. And actually that's provided quite a lot of confusion for a lot of people living with disabilities in terms of what they should be doing at this time. Bill also mentioned that for them, in terms of delivering activity, that's been one thing, but actually before they even get to that stage, it's been about trying to share some of that information about what they can and can't do. So a lot of people actually were not necessarily aware of the rules in terms of what they can do in terms of getting back to activity. So before we even got to the stage of delivering, there was some work there to be done in terms of building trust and confidence for people to come out. We spoke about a different way of working now, so how that requires a different skill set in terms of how we're working with people to build that trust. There's more of an awareness now around the mental well-being as well at this time, due to the amount of sort of isolation and shielding that people have been going through. There was some good sharing of best practice in terms of online delivery, so stuff that's worked really, really well. But at the same time, there's an appreciation that there is still that digital exclusion for a lot of people. So actually, if somebody's offered a Zoom session and they go onto it and they don't like it, or they don't work well with it, that's it. We might have lost them then for a few months. We also spoke about the need to share good practice and disseminate good information at this time. So more collaborative working, not just to build the confidence and trust of the participants, but also of the workforce as well, to be able to go out and deliver safely at this time. And that sort of led us on to a discussion around comes back to that directory of services again, Jem, which I know is something we've been looking at for a long time now. But actually, where can providers go to signpost somebody on to a safe activity that, somebody in their session, they'll be doing the session, that session isn't going to run anymore, or it might not be right for them. Actually, where can they go now for something that's in their area, but they know is going to be inclusive? So if it's not disability specific, is it going to be inclusive? And does the provider and the participant have the trust and the confidence to signpost that person on to that activity? And I think we also then spoke about how does, as a county, how do we all come together to sort of champion disability sport at this stage to try and reach those people? I think it was interesting what Tim was saying earlier on about there's one issue where it's how can we allow what's happening to continue to be delivered safely, but actually how do we continue to target new participants at this time? Because for a lot of providers, it's about getting people back into activity who was already engaging. But then there's that issue around how do we get new participants to engage in physical activity safely? And it's just that discussion around what should our approach be in terms of disabled sport. I'm not saying we got the answers to that, but it was what we were discussing towards the end.
Great, thank you, Ross. Again, kind of really interesting, and a few different things popping up. So yeah, I think our group very much kind of covered some of the other bits. Some of the key things that maybe haven't been talked about in other groups was around adaptation and thinking about how, I suppose, we talk slightly about the messaging, but how we're really providing that messaging and the difference between the rules and the guidance, and ensuring that it's kind of clear, and there is that clarity for not only the individuals but the providers, so they can you know, obviously delivering that kind of safe environment, and then there is that trust and that confidence kind of building for those participants. I think again it was something that was raised in the national kind of event around that. And you know, Tim, I think, mentioned that you know, Janet and Story, they were saying that the care worker couldn't help, but actually the guidance is that they can, you know, and that just shows that an individual who is proactively supporting someone to be physically active and is supported by national organisations, that message still wasn't necessarily clear. So I think, you know, we do have that part to play, ensuring that those messages, you know, are communicated and are clear, to help with that confidence level. We also talked a little bit about facilities as well, and the fact that, you know, unfortunately there are quite a few facilities, especially in Sussex, that have closed and gone into administration, you know, and that's going to have a massive impact on, you know, opportunities for people to participate in various sports. You know, some of those facilities have got swimming pools, which we know are particularly used with some types of physio provision and linked to kind of well-being. So yeah, there's a real concern on that. But what we did talk about is that, you know, in some instances those facilities may be taken over by a different organisation, and how can we ensure that when they do reopen under new management, that they are responding inclusively, that what provision was already there. So, you know, if they did provide for instance a swimming session for children with disabilities, that is something that's part and parcel of what they then offer when they reopen. And you know, I think we've all got maybe a part to play in that, is, you know, ensuring that we're advocating those messages, that we're providing them with the tools and resources that are out there to help them if they haven't got the confidence around how they can go about that, you know, and having those conversations with those, you know, facility providers. One of the other things that we kind of talked a little bit about was who should we be influencing, and I mentioned there about, you know, talking to facility owners and thinking about maybe leaders in the local authorities around the facilities. But we also said about actually influencing disabled people to have their voice heard. And what we feel and what we discussed is that you know, some disabled people don't necessarily feel confident at doing that. They may have tried to give their voice and not been able to in the past, and they haven't been listened to in the past. So, you know, how can we empower them? How can we provide them with a platform to do that? Because ultimately we want to understand the real needs. We want to understand what it is that we can do to support them and give them that platform. So, you know, maybe just thinking as part of the network is how can we better do that, you know, and we've got some great advocates like Paul, you know, who is very confident at providing his thoughts and some great insight, but how can we get more individuals like Paul, you know, in kind of on board and part of the disability network, and really then, you know, sharing those stories. So, you know, if we can get case studies and videos that can be shared around kind of the wider network. I think the only final thing was that there was actually quite a lot of positive comments made as well in the live event, and kind of touched on, obviously, you know, the strategy, for instance, but also, you know, some of the positives that people have had through the COVID experience and how things have changed, and how maybe, you know, the online provision has helped to engage, or, you know, individuals that haven't necessarily engaged with face-to-face provision before. So I think it's not all doom and gloom, in the sense that we've got a real opportunity to really kind of learn as well from this kind of given situation, and like we said, you know, reassess and think about kind of resetting, but in a different way, and taking on board all of the kind of voices that we've heard. So that kind of is a summary of our group and what kind of we talked about. So I was going to kind of do a brief wrap up of the kind of the national response, and then some of the thoughts that you've had, and next steps. But I think really everything we've kind of talked about very much kind of resonates with what the national response we're saying, and it's about kind of that listening and understanding, you know, and being proactive and reacting. And I think what we're really keen to understand is how can we as an active partnership support our partners kind of moving forward, and how can we better share this learning. So I suppose rather than kind of me just whittering on again and now we've got everyone back kind of in the room, is there anyone that would like to kind of share kind of a story or something that they've specifically done that they think would be really beneficial for the rest of the network members that are attending to kind of hear? So something that's innovative, or, you know, how they've collaborated with kind of other partners, or even advocated to leaders in our area. You're all too nervous, or have you you run out of conversation from your group discussions? That's fine, not a problem at all. So what I'll do is I will wrap it up here, because I am conscious that, you know, you've been online all morning. So I think for me, I think there's a real positive opportunity here. I think the next steps are that we collate all this information. We obviously ensure that we're engaging with more partners, that those that can attend, and ensure that we get their thoughts, and then kind of make a commitment as a organisation and as a disability network of how we're going to move this forward, and have maybe some sort of pledge of how we're going to do that, which we will send out to the network. But I want to kind of reiterate that although we've got the disability network and it has had an emphasis on, you know, supporting people with disability, and kind of over the last kind of couple of years looking more at long-term conditions and mental well-being, the work that we're doing is around inclusive for all, and I think it's important that if you make provision inclusive, if the workforce that is engaging has got inclusivity in their mind, then more people will be active, regardless of whether they've got a disability, the locality that they're from. You know, I think inclusivity is something that we all need to be championing, and be proactive in taking kind of that leadership and advocacy kind of onwards into our own networks. So unless anyone had any further thoughts. Oh, Paul would like to say something.
Can you hear me okay?
Yeah, we can, Paul.
I think one of the things we found very important is actually the sort of relationships we have with tennis venues, and with the sort of local overriding LTA in the county. And I think that's been built up over the number of years of just really making sure we involve the people we're working with and not just come along and then disappear, but actually be part of that organisation to the degree that we can. So it sort of builds up that sense that they like us being there as much as we like using their facilities. So it's very much a partnership and a collaboration that does work, and that's helped in sort of getting us sort of straight back into using facilities when we've had the opportunity.
Thank you, Paul. That's a really good point. Yeah, it's that partnership and that trust and sharing as well, isn't it? Sharing that knowledge kind of both ways. So thank you so much. That's really insightful. So a couple of minutes left. Anyone else want to add their thoughts or provide any specific insight?
Hi, Gemma. I just think next year it's going to be really important for us all to kind of raise awareness again, and obviously it's something we have to do anyway, but to really get people back out and get them active and assure them that it's the right thing to do and it's a safe thing to do, and that we're all providing things in a good way. I'm really keen on the idea of us all sort of getting together and having sort of some kind of festivals and things that showcase what's on offer locally. Now, I'm already creating a little idea in the back of my mind, as I generally do, because we've got our new venue now, as you may know, which I'm sitting in, obviously, and I'd love to host something in Eastbourne around sort of spring Easter time, assuming we're coming out of things, to have other providers here and just, you know, really show what's on offer. And much as it's not my place to do so, I think if we could do something like a big summer event in Brighton and Hove Stadium, that would be amazing. So you know, if they want to volunteer to get involved in something like that, I think that would be fantastic, to have a really beautiful resource like that and have all of our disability sport or inclusive sports providers from the region there to show everyone what's on offer. That would be fantastic. So I think things like that next year are going to be really key to getting people's attention and getting people out.
Thank you, Loretta. Yeah, I think it's that visual, isn't it? It's having something that's, we were going back to that kind of in people's minds and visually being there so people can see what's happening. So no, keep us posted. Keep us posted. That's probably one of many things that you've got going on that you're thinking of doing. So we are at time, so I think I just would like to say thank you so much for your participation today. Like I said, if you weren't able to watch this morning's live event, then it will be available on the Activity Alliance website and on the YouTube channel, so you can go back on that. And like I said, this is being recorded, but we'll also collate all the notes and pull it all together and provide that out to the network. So thanks once again, and have a lovely rest of the day.